everybody. Can you hear me all right? This is my kind of meeting. Usually I present at conferences and I don't get to have a glass of wine just that far from me, so I'm really glad to be here tonight, my kind of meeting. I'm going to talk very briefly, 30,000-foot level, about a project called Text for Baby, and specifically the evaluation of Text for Baby, which I'm leading. How many of you here have heard of Text for Baby? So quite a few of you, that's great. Well, it's gotten a lot of publicity, and it's a really exciting program, and I think a great opportunity to build the knowledge base and evidence base on mental health. That's what I'm going to really quickly talk to you about. Text for Baby, first and foremost, is a brand. And what I mean by that is that it stands for something, it represents something, it's positioned in order to, can you hear me okay? No? Is the mic working okay? I'm talking right into it. Okay. It is a brand. It stands for something. It represents a set of values. It has associations for the audience. So we're trying to get people to affiliate with this brand, and we're trying to see whether that strategy, that marketing strategy for the topic of reproductive health, maternal and child health is going to work or not using mobile health strategy. It's based on behavior change theory. I'm going to talk about that briefly. And we're looking at short-term, intermediate, and long-term effects of delivering text messages to the target audience, which is low-income women, primarily Medicaid eligible, and seeing whether or not that leads to improved behavioral and other outcomes. So real quickly, theories of behavior change. Why do we think text messaging would be a way to improve the health of low-income women around reproductive health, maternal and child health issues? Well, a lot of them lack knowledge, and a lot of them are not accessing services that are actually available to them. We think that text for baby messages can be a cue to action. They can reach the consumer right at the moment when they need to be making these decisions. It's tied to that very predictable 9-month period when a woman is pregnant, and the messages are staged in order to cue specific actions along the way. Also social cognitive theory. We think that we can use text messaging as a way of modeling desirable behaviors, and that will have an effect through the messaging on women's behavior. This is quickly a kind of conceptual model of the evaluation. Basically, we want to expose women to the text for baby messages. We want to get a high awareness of the messages. And then we think that through that we can generate positive reactions, that they're going to receive the messages positively. They'll think that this brand is something that they want to affiliate with. And the brand is recommending that they do a number of things. Get prenatal care visits, eat better, avoid smoking during pregnancy, don't drink, things of that nature. We think that these, if they receive these messages positively, it'll build up their self-efficacy. They'll have greater personal belief in their ability to navigate the healthcare system, for example. And that ultimately, by increasing their self-efficacy and other kinds of socially modeled behaviors, that'll lead to behavior change, that they'll be more likely to do these behaviors that they now feel like they can do. Text for Baby will be like a trusted friend, a source of information and advice that they trust and that they're able to act on. There's a lot of examples of this that are growing in the public health literature. I would liken what we hope might happen from this campaign to things like the Truth campaign, the Verb campaign, and others, some of which have also used mobile health strategies. Ultimately, this is going to lead to better health outcomes. We don't necessarily expect to see this quickly during the time frame of our research, but we're hoping to see that in the long run. So at 30,000 feet, just very quickly, we want to know things like how much exposure is our audience getting to the Text for Baby brand? What's the dose-response effect of that delivery of the messaging? And what is that exposure among different population groups? Do Hispanic women, are they more likely to attend to the messages than white women? What kind of differences do we see in terms of socioeconomic status and so forth? Does it actually work to change behaviors? I mean, that's what we ultimately care about. And also we care about how it works. What are the processes? I just showed you that conceptual model a second ago. What are the processes through which it works? So that in the long run, we can develop better versions of interventions like Text for Baby in the future. This is a now somewhat dated slide, but at this point in late July of 2010, dated 2 months ago, there were about 67,000 or so subscribers to this program. It was launched in early February of this year. There are now just over 80,000 subscribers, so it's continued to grow at a steady pace. This is an eye chart, if there ever was one. You can't really see exactly the detail there. But basically it shows that there were a lot of key events along the way that led to spikes in subscribers and new enrollees. One of them was early on, you see those big spikes. MTV had some programming that highlighted Text for Baby, and that led to some big increases in enrollment. Great. Process evaluation. Who subscribes to this thing? You know, what do they look like? What's their profile? Are those people who are subscribing finding these messages to be useful, trustworthy? Are we building the brand, basically? What kind of differences do we see in that between different groups? We're doing these kinds of evaluations using different methods. Mobile surveys are one of the main ones, both automated survey formats and interviewers calling to mobile phones. People who subscribe to Text for Baby provide their cell phones, so we have basically a list of people that we can go out to and get evaluation feedback from. It makes it very much easier than some other methodologies. We're also doing in-depth outcome evaluation. Do they use the website? What kinds of effects does this have on prenatal care behaviors that we're looking to change? Attitudes change. What kinds of outcomes are we getting along those lines? We're using a number of different methods. We're designing randomized experiments, 2 of which are up in the field right now. Basically, partners sign up to deliver Text for Baby or provide it, so hospitals, clinics, and so forth. We're working with them in order not only to reach out to participants, collect data from them, but also to extract health record data, so that we have some other data you can't really get through surveys. I know I'm just about out of time. Basically, we're trying to build an evidence base, ultimately, and develop a better theoretical framework to understand how mHealth really works. mHealth is the answer, well, what was the question, right? We know that a lot of behavioral theory is very effective. How does it work within the context of mHealth? We're trying to figure that out. So in the long run, 5 years from now, 10 years from now, if we wanted to know how effective is this field, what will Text for Baby have contributed to that? I'll stop there. Great.